Friends, glad to meet you on Saturday. Saturday is a very good day for us because we are talking with the people who are interested in knowing about Puberphonia. So today we have completed 1,234 cases of Puberphonia. We feel this is a great achievement for us. So invariably, every week we are getting case. So the depth of the case is not difficult at all. Lot of patients are there. So when we treated 1,234 cases of Puberphonia today, the Saturday, September 2023. So it is a good day for us. We can discuss more about Puberphonia. Still, people not aware what is the cause for this Puberphonia. What is the cause? Everybody is asking, what is the cause for Puberphonia? So, many people had explained this disorder as a psychological reason who resist maturing and lowering the pitch of the adult voice and maintain the high pitch voice of the pre-adolescent. So they resist. That is what people say. So that is the cause for Puberphonia they feel. So individual resist for maturing. Because this is very well told by the father of speech pathology, Ingotics. So he had a lot of research work, University of Iowa Foundation, and he is working in the distinguished as a professor in the Department of Speech Pathology and Audiology in the School of Music. Dr. Titz. And he is the director of National Center of Voice and Speech, which is located at Denver, which is a center for performing arts attached with the University of Iowa. So he had a good knowledge about the voice and speech. He is a physicist and engineer. He has applied his scientific knowledge to a lifelong love and clinical voice and vocal music. His research includes biometrics of human tissue, acoustic phonetics, speech science, voice disorder, professional voice production, musical acoustic, and now his interest is more on computer simulation of voice. Dr. Titz has published more than 350 articles in many journals and authored a book of titled Principle of Voice Production and Myoelastic Aerodynamic Theory of Phonation. And he is going to complete his third book called as Vocology, Vocal Science. Dr. Titz is called as father of vocal science. This is a specialty in speech language pathology. So the father of vocal science, what he says, the whole world definitely should accept. Very good idea. And he is a man suggesting many reasons why and what is the cause for this puberphonia. What is the basic cause? Why puberphonia occurs? So he is the director of National Center for Voice and Speech, and he is a father of vocal science, voice science. So he says puberphonia means high-pitched voice. Yes, occurring in male. He says high-pitched voice exists thanks to vocal cords which are not long, strong, and ready for good vibration. This is what his observation. In his National Center for Voice and Speech, the vocal cords are not long, strong, and ready for good vibration. But all over the world, everybody says the structure and function of the larynx is normal. Vocal cord, normal. I had 1,234 cases of puberphonia. I had examined the larynx. I am having the movement photo of vocal cord. In all cases, I am not telling the vocal cord normal. In that 725 cases, the vocal cords are normal. There are variants, just like small vocal cord, bent vocal cord, not paralysis, paresis of the vocal cord, atrophy of one vocal cord, a deep gutter in between true and false vocal cord, and the position of the corniculate cartilage is different, the overriding, and the size also different. These are all the things I personally feel as a normal variant, because the right side of the body, human body, need not be similar to the left side of the body. That too in larynx. The right vocal cord is supplied by the right recurrent laryngeal nerve and left is supplied by the left recurrent laryngeal nerve. So what happened? So different nerves supplied. It is not supplied by one nerve. The length of the right recurrent laryngeal nerve is different. The length of the left recurrent laryngeal nerve is different. And the roots are so different. So there are a lot of, because one of the recurrent laryngeal nerve which encircle the great vessels and come and supply the vocal cord. That is why it is called recurrent laryngeal nerve. So all these points we have to note. That basically, puberphonia means change of voice without any anatomical abnormalities in the larynx or vocal cord. This is the basic idea. So we strongly believe larynx, most of the cases of puberphonia, the larynx and vocal cord structure is normal. Even within a week, we got a case of sulcus vocalis, 2 times operated. Still, the patient had puberphonia. We have treated with Kumar technique, our own technique, uvula manipulation and resonance. Within 5 days, he got the normal voice. So this is the position I want to explain. So definitely the number of cases I had seen is a small than that of other ENT surgeon. I am not telling that I have more thing because I am only seeing puberphonia now after corona. As a ENT surgeon, I used to do lot of surgical works in ENT. Now all the things after corona I have stopped. Only puberphonia. I want to concentrate on puberphonia. Why means the boys with puberphonia, every day I am asking, I am just call them, what is your problem? What is your problem? I really get upset when they tell their problem to me because it is a devastating problem for them. Really. Few people, they feel their life is over. Until maturity, they are happy. When they got maturity, the voice is not low pitch as other boys. They got upset. Their other boys are making funny of them. Why this boy is talking in a female tone? This had created a great impact on puberphonia boys. So I am going on now publishing papers because still the community is not able to recognize. Thousands of cases of stammering is there. Who bothered about stammering? Oh, nothing. Nothing means what will happen to the boy? So we are not taking seriously. And fundamentally, we feel that it is not a disease, that's all. Okay. Definitely, it is not a disease. It is not a disease, not a deformity, not a problem, provided mentally you are strong. Oh, nothing. This is a high pitch voice, which is a trademark for me. Many cinema actors are happy with a high pitch voice. So it is an identity for them, high pitch voice. So nothing to do with their life at all. But if they get upset because of colleagues' one good article and published in the International Journal of Otorhinolaryngology. This is an international scientific journal, science publishing group, which publish it. So all our ENT surgeons will read this scientific journal and they will understand. But it might various reason we can say. But it is not because the impact of puberphonia is more. There are a lot of misconception about the puberphonia. So I just want to enlighten every day, at least the public should understand about puberphonia. Yes, it is not a disease. I know there is no problem. If even I got a hyper-pitch voice, I can have a normal life. But the society sometimes feel he is not a capable man. He is having lady character. So that only if it is in my mind, it hurts me. That's all. Because others feel like that, then what can I do? That is the another problem. So the treatment is necessary. We have to consider as a disease. Why I am telling this as a disease means in the 10th century itself, we are told this is as a disease. Not only disease. She compared 4 diseases only. Koon, Kurudu, Chevidu, Pedu. Koon, Kurudu, Chevidu, Pedu. What is a big thing? The 4 deadly problem to live in this earth, Aviyar says. Blindness, deafness, and body deformity, and puberphonia. If at all one ear is not able to hear, what is the problem? No problem. But she says it is difficult to live. One eye blind, 2 eyes blind means, what is the problem? They can become very intelligent, happy, great people, great poets. But she says it is difficult to live in this earth. With the physical deformity, if you are having a little more smaller in size, what is the problem? No problem. But she has found out that is the problem. The 4th one, she says, man having lady voice, that is the paid, she says. So some category itself, this problem has to be brought, but not as psychological, because the psychological is overloaded because of the friends. But we Indians can make a big difference in the world because our knowledge is great. We have so many resources. The basic point is, all over the world, the puberphonia boys mean that they are having high pitch, change voice, cracky voice. No, it is not like that. They have not got the changed voice that is called puberphonia. Voice not broken. That is the definition. Will you accept? Yes, it should be accepted by the people of Kerala and Tamil Nadu. We know the adult boy means the voice should break. This I want to stress. What is the maturity of a girl means the girl got period. What is the maturity of boy is the boyhood voice change. That's all. Only one word answer. Other stories are only substantial news only. But the maturity means ladies means got periods. Gents means the voice is changed. So this should be there in the textbook. That's all. For small boys. Then only really they understand the problem and all without any stigma. That's all. So lot of things happen because of this puberphonia impact. So the suffering for the boy and suffering for the family and suffering for the society. We can go on enumerate the problem, physical and mental health. He will have a physical and mental health. 90% of the boys are skin and bone. They won't eat properly. Their physique is down, mentally upset because they destroy their self-esteem. That's all. God had given us a small punishment or big punishment. We have to live with that. But what happened with the human being, we are just happy with what we had. This is our what ancestors are teaching. Be happy with what you are. No, we should achieve more. That's what the modern world needs. We have to achieve more. Don't be content with what you had. You have to serve the society. That is why you have born in the society as a human being to serve, help the society. You have a decent, yeah, settled and pleasurable, not harming other people. That itself a great thing to the nation, I can say. So puberphonia boys had a more physical and mental health problem, and it will destroy their self-esteem. So they will lead a low confidence, self-doubt, anxiety, and depression. Self-doubt is a very big problem. Even we see daily patients nasal block means immediately they think cancer had come. Difficulty in swallowing means immediately they feel some tumor had come. So self-doubt is a very big problem. How to live with that? So you should have a confidence in your life. Then only we can aim for a better future. So with low confidence, how can we move further? With self-doubt, anxiety, and depression. And then avoidance behavior. Everything is avoiding. You won't go to the school because other boys are criticizing. So you won't go to the school. You'll go to the, say parents that I'm going to the school, but go to the garden and you take food and come back correct 4 o'clock. This is a habit many boys are doing. Puberphonia boys. Avoidance. Obsessive thought about self-image. Very bad thing happen if you are one happening. thinking, am I a girl or boy? The self-doubt. I'm not telling with my imagination. This is the real story of the boys who gives me before treatment. Am I a girl or boy? Puberphonia. So how their mind is suppressed or depressed? Try to understand this problem. The whole nation should take this problem very seriously and treat it. That's what I'm seeing most of the boys, skin and bone. They are not eating properly. Eating disorder they will develop, like anorexia, binge eating. So they are not interested in life. We can increase the confidence by saying, counseling, all the things won't work provided you satisfy them what they need. If you are not satisfied, giving a satisfaction, then it is a waste for the whole nation, I can say. So with this resultant feature, what happened is their marriage is delayed or no marriage for them. But they will tell all excuses. That is the main thing, because marriage means it involves in sex also. So they won't directly say. Others, even ladies are telling, are you having a lady character? If you are having a lady character, your wife won't accept you. So this is the society. Male should be male, female should be female, with internal and external. Everybody needs like that. But if a puberphonia boy want to avoid marriage, he won't tell that he is having puberphonia boy. He will tell, because what happened is mother and father definitely feel the voice is normal, because they are going on hearing from their childhood. He is eating well, walking, running, everything is normal, not delayed in any activity. So how the mother and father feel? They will simply say, my son is normal. Added to that, they will get opinion from other doctors, other friends, highly educated people. They also will tell the parent, the boy is normal. He is little shy, that's all. No, he is depressed. You have to relieve it first, not try to satisfy him. That is what I want to impress the society. It should be treated immediately with confidence. This message should reach throughout the world, not Tamil Nadu or India. All over the world, the concept of puberphonia is same. So it is a neglected disease, I can say, underestimated disease, underdiagnosis, undertreated. What will happen? Puberphonia means a thing is so simple. But if I tell a comparative study of stammering, you will understand. Oh, that boy, this boy is having stammering. What happened to their life? They get depressed. But we know there are great stammering people who are all great politicians, great achievers. That is the minor one. If you are not able to get depressed, then you can be active, happy, and great. So the getting depression is the very big problem with the puberphonia. Puberphonia boys don't get depressed. It is not simple word. We can treat it in 5 days without any surgery or medicine. Only by EULA manipulation. So that is all only. Why EULA, this doctor is more concentrating? I know I am publishing a paper. So these psychological problem I have published, it had come. What the importance of EULA also I am going to publish. That also will come in the international journal. Most of the puberphonia boys live lonely, and if father and mother are blaming, they will leave the home. Because there are lot of puberphonia boys, to help them, they will join as a group and spoil their life, I can say. Few boys with puberphonia join together, simply it will spoil their life, because they will be away from the society. They will form their own society. They have formed. That's what I am telling. And it will only human being means you have to do work. You have to earn money. You have to be happily live with your family and friends, and you should have neighbors. They should be mingled with you. So they will, most of them live lonely and leave the home. Some even prefer to live with their friends. That is another big. See, we had statistics. I am just telling. It is not a random story at all. They live with the friends in old age, whether lady or gen. If you want to live alone, it is better to live with the friends. That's all. That's what happening. Old people try to live with their friends when there's no family friend. That's all. Family people no money. They are bothered about their own family. So how to maintain? Okay, this is a problem. They try to live with a friend. And how many days you can live inside the room without having the fun of the world, without fighting, without happy, without smile, without speaking with the neighbors. Puberphonia boys cannot talk with the other boys. Normal place. They cannot go to the hotel and get things. They cannot purchase a bus ticket. They cannot purchase a train ticket. They cannot go to the hotel and demand for the board, because the boys will reveal what they are. So what will happen? Leave, and their tendency is go somewhere. That's all. This is what happening. What a pitiful thing. So this idea, I have already published a paper, and which had come in the International Journal of Otorhinolaryngology. That is the International Journal of Otorhinolaryngology. It is a scientific journal, science publishing group. So it had come with the ISSN number 247 online, and in a printed form 2405. All ENT surgeons will take as early as possible and give a good cure for the puberphonia boys. So thank you for listening. I will hope to see you next Saturday, 17th the same 5 to 5:30. Hope to see you. Great day. Thank you.